Welcome to Rishabh in Germany, your guide to ease of life as an international student.
Hello everyone, welcome back to my channel. Today we're gonna discuss about the insurance system of Germany. We will talk about the health insurance, and uh, since there are quite many confusions that keeps flowing within students that are trying to come here. So yeah, we will have a clear discussion on that. So obviously starting with the health insurance, and as you all might know that in Germany there are two options available. One is public, one is private. So what is the major difference between the public and private? And who should take public and who should take private? The answer is very simple. If your age is under 30, you should go for public health insurance system. And if your age is above 30, then you have to take private health insurance system. Another criteria of the selection is your course that you're doing. If you are in bachelor's or master's, of course, you can take public health insurance. But if you are coming here as a doctorate student, you might need a private health insurance. You might not be eligible for a public health insurance in that case. Well, there are many reasons behind it, but to understand it clearly, these two are the main differentiations that are there. On base of that, you have to make your selection. So what is the major difference? If you are taking private, if you're taking public, the major difference comes for the students is in the cost. Private health insurance falls around 30 to 50 euros per month, whereas public health insurance falls around 130 to 150 euros per month, which is really high. But yeah, that's the case. You have to take it. And if you are under 30, you cannot opt for private health insurance while coming to Germany. You have to take public health insurance if you are under 30 and if you are in master's or bachelor course. If you are in doctorate, that's completely fine. You can directly come here with the private health insurance with like 30 or 40 euros per month. Uh, but in terms of their workflow, how does this insurance works if you really need them? In that case, private health insurance really lags behind. That is the case. They are having really less monthly rents. So let's say if you need to see a doctor with a public health insurance, you can just walk in and it's completely cashless system here. You don't need to pay anything. They don't even ask you. You just need to present your health insurance card that your insurance provider will already give you once you will reach here in Germany, and they will just swipe it and the insurance company will directly pay to them. But in the case of private health insurance, in most of the cases you have to pay with cash or your credit or debit card at the hospital. uh, and like a general visit to a clinic here will can cost you around 50 100 euros or 200 euros, uh, which maybe you can pay at the point with your savings. But it's a bit I mean, yeah, you need to pay, so it's not really comfortable for many students. But since they're above 30, they can't really do anything about it. That's how it works. Plus you are getting really less price monthly. So yeah, that's the difference in the workflow of these insurance. And then these private health insurance pay you later. They will of course give you a refund after a few days in your account. Yeah, so that's the major difference. Yes, but if you really want that, okay, I want a monthly budget and I cannot pay 130 or 150 euros per month for a public health insurance, then I need a private, and I am even under 30. What should I do? In that case, I will recommend, since you need to apply for a visa, take public health insurance over there, come here, and after 3 months, you can opt out from your public health insurance. That is a procedure that is available here. That after 3 months of like staying in a public health insurance, you can officially opt out. With it, you just need to write an application to your public insurance provider. They will confirm you that okay, you are officially opt out, and then you can apply for a private health insurance. So that is possible. But yes, as I already mentioned, that private is cheap, but again, you need to pay in most of the cases by your own money. Well, it's not that you always need to pay. Like, of course, if you, well, I hope nobody needs that, but just in case if anyone needs a big hospital treatment, or some sort of very expensive, like operation or some kind of surgery, of course they don't gonna ask you money. They know you are a student. Hospital will directly contact your private insurance provider. So in those cases, you don't need to worry that, okay, what if my 2000 euros bill will come of the hospital? What will I do? No, you will not need to pay that, even if you are holding a private health insurance. That is only in your general hospital clinic visits, or otherwise, yeah, even if you're a private insurance holder, the hospital will not ask you for that big amount of money. So yes, so that was the major difference between both of them. Yes, and yes, to summarize, if you are under 30, and if you are coming here for bachelor's or master course, you are eligible for a public health insurance, and which costs around 130 to 150 euros. And if you are above 30, or if you are a doctorate student, then you have to come with a private health insurance, and you need to pay 30 to 50 euros per month. And in private case, you have to pay with your own money for the clinic visits, whereas public health insurance are really cashless and seamless process. You just need to present your ID card, and then you're done with the bills. So in the next video, I will also talk about some other insurances that are available in Germany for students that you should take, and also which are not really recommended to take, which are really waste of money. We will discuss that. So thank you for watching the video. I will see you in the next. Stay tuned.